Respected elders, brothers and sisters, Jai Sai Ram. We hope you are all keeping well. Our monthly webinar is on nutrition and gut health, led by Dr. Mahesh Shah. Dr. Mahesh Shah completed his medical training at the Hull York Medical School in 2010 and his general practice training in London with the Royal College of General Practitioners in 2015. He has also studied naturopathic nutrition at the College of Naturopathic Medicine. Dr. Shah currently works as a GP in London. He sees chronic disease and medically unexplained symptoms, and although he helps his patients, it doesn't always seem to solve the issue. As a doctor, he wanted to look for a solution so that people can feel happy and healthy again. Having qualified in naturopathic nutrition, Dr. Shah has recently started up his own nutritional therapy service. The service is named The Green Doctor, which inspires and empowers people to great gut health and well-being through the foundations of naturopathy and nutrition. Dr. Shah is blessed to be born into a Sai family and has served in Sai medical camps. So without further ado, I look forward to hearing our topic today, named Unity in Diversity. Over to you, Dr. Shah. Sai Ram.
Sai Ram to everyone here and to those who are watching the recording in the future. Firstly, before we get started, my most heartfelt salutations to our divine creator and universal companion, Sathya Sai Baba. Thank you always for your love, guidance and inspiration. Now there's going to be a lot of health information in this presentation, but it's not intended to replace the advice of your doctor. So please do consult your doctor first for any health problems that you may have. So what are we going to explore in this presentation? Well, firstly, we're going to have a brief recap of Swami's teachings on unity in diversity, and then we will move on to understanding how unity in diversity is key to our health and well-being. Swami has spoken and taught us a lot about unity in diversity. I take a couple of sentences from Sathya Sai Speaks. Diversity in creation is an obvious fact. No two human beings, not even twins, are identical. We must learn to see the unity that underlies the diversity. But how does unity in diversity relate to our health? The story begins whilst we are still developing our human form. Whilst in our mother's womb, contrary to what we thought, we are exposed to microbes such as bacteria. And when the baby is ready to be born, as it passes through the birth canal, it swallows bacteria. And thus starts the seeding of the gut microbiome. What is the gut microbiome? The gut microbiome refers to the trillions of microbes, such as bacteria, viruses and fungi, and their genes that live in our digestive system, from our mouth down to our large intestine. And it is in the large intestine, as highlighted in the picture, where they are in their highest numbers. Over the last decade or two, increasing scientific research is showing us that the gut microbiome is vital for health and well-being, and there are various factors throughout life that can affect it. Just a few slides ago, we saw how the gut microbiome starts taking shape prior to birth. Why is this important? Looking at this picture, you can see the whole digestive system from mouth to the bottom. Now, what we put in our mouth is coming from the outside world, so you can consider that the gut is actually outside the body, and contents in the gut only enters our body once it is digested and absorbed into our blood. And as the outside world isn't necessarily clean or sterile, there needs to be a strong immune system in place in order to filter harmful things from the harmless. Let's have a very simple overview of the immune system. This picture shows the various cells of the immune system. On the left, you can see cells involved in innate immunity. The innate immune system is the initial emergency response to something foreign and harmful to the body. It causes inflammation or irritation in the area, and subsequently the symptoms one may experience with an infection. This response occurs over minutes to hours. Importantly, it helps to initiate adaptive immunity, the cells on the right of the picture, via the cells in the middle of the picture, labeled dendritic cells and macrophages. And this is when the body makes a memory of the invader for next time, so that our response is much quicker and we don't get ill. This phase is also anti-inflammatory, important as you don't always want to be in an inflamed state. The left side of this picture shows us the organ called the thymus and also the bone marrow. This is where the immune cells from the previous slide are made. However, it is the other areas of the body, such as the spleen, tonsils, airways, and gut, that train these immune cells to do their job properly. A staggering 70 to 80% of the immune system is in the gut, and it's the beneficial bacteria in the gut that help to train it. Here is a diagram of a portion of healthy gut. Along the top, where food and substances would pass, there are a diverse number of beneficial microbes. Below this is a mucus layer which serves as a further protective barrier. And underneath these are the cells that separate the outside of the body from the immune cells and bloodstream. In a healthy state, these cells are tightly lined up against each other and will only let things through that are known to be harmless and essential to health and nourishment. However, in an inflamed state, the integrity of the various barriers is compromised, leading to the immune system potentially reacting to foods and other environmental particles, culminating in allergies and sensitivities. A natural birth seeds beneficial bacteria which help to keep the gut healthy and train its immune system appropriately. On the other hand, a caesarean birth exposes the newborn to microbes from the skin, which can lead to initial inappropriate training of the gut immune system, potentially predisposing to allergies and other immune disorders. However, we must appreciate the fact that caesarean births may be the only option, such as in emergencies, and there are other factors that help to shape and change the gut microbiome. So what are prebiotics? Prebiotics are food for the beneficial bacteria. They use prebiotics to make postbiotics, which play an important role in gut and overall health, such as being an energy source for the cells lining the gut, keeping the gut immune system in check, appetite control, sugar balance, and suppressing tumors. However, formula feeding doesn't provide the same benefits and could lead to further dysfunction in the gut immune system and, as a result, further inflammation. However, once again, we must appreciate that not all mothers are able to breastfeed, and there are indeed other lifestyle factors that can impact on the gut microbiome throughout life. These days, we tend to live in environments that are overly clean and away from nature. However, what we are seeing in scientific research is that spending time in nature and the outdoors, and with animals, helps to further train and develop our immune system and learn that things like pollen and fur aren't harmful, contrary to what we see today with so many people having allergies to these. Now, another vital component to a healthy gut microbiome is food. To illustrate this, I'd like to give you a simple overview of a study carried out examining poo samples of children from Burkina Faso in Africa and Italian children. The reason poo samples were taken is because this is how the microbes can be examined. So what the study showed is that there was a higher diversity of beneficial bacteria in the African children. And when they examined the diets of the two groups of children, they found that the African diet contained a lot of whole plant foods rich in fiber, starch, and plant proteins, whereas the Italian diet was higher in animal protein, fat, and processed sugars, and low in fiber. And here is a study in older people which showed that older people living in institutions had less healthy and less varied diets than older people living in the community, leading to less beneficial bacteria and higher rates of diseases. So we have seen that fiber plays an important role in ensuring a healthy gut microbiome. It provides the prebiotic for the beneficial bacteria, which in turn make postbiotics, which have a number of health benefits. And what foods provide us with fiber? Whole plant foods, and these include fruits, vegetables, whole grains such as brown rice, quinoa and wholemeal pasta, legumes which are beans and lentils, nuts and seeds, herbs and spices. Plant foods also contain polyphenols, which are phytonutrients, defined more simply as nutrients only found in plants. Polyphenols have been shown to increase the number of beneficial microbes and reduce harmful ones, improve obesity and diabetes, reduce blood pressure, cholesterol and heart disease risk, and reducing bowel cancer risk as well. Foods of animal and processed origin, containing animal protein and fat, processed sugars, have been shown to reduce microbiome diversity and balance, termed dysbiosis, which can lead to weakening of the gut cell lining, commonly called leaky gut, leading to long-standing or chronic inflammation. Here is a picture showing a damaged and leaky gut. Firstly, at the top you will see dysbiosis, an imbalanced and less diverse microbiome. Next you see an absence of the protective mucus lining, which would be maintained by beneficial bacteria and postbiotics. The lack of these protective barriers can damage and weaken the gut cell lining, leading to leaking of gut contents into the other side and activating the gut immune system. You will also appreciate the purple hexagons with the letters LPS written in them. These are products of the bacteria in the gut or animal foods, which can leak to the other side and set off a chronic, long-standing immune response and subsequent chronic inflammation. And scientific research is showing us that this chronic gut inflammation can lead to diseases such as obesity, diabetes, heart disease, autoimmune diseases, arthritis, cancer, and more. And here is a scientific study that shows that LPS leaking through the gut and causing chronic long-standing inflammation can also cause inflammation in the brain and disrupt sugar control in a part of the brain called the hypothalamus, even if you have a thin body habitus. Now, I appreciate this is a very busy picture, but I'll explain it to you. On the left, eating animal products such as meat, eggs, dairy and seafood changes the kind of bacteria we have in the gut. These bacteria make a substance from these foods called TMA. TMA gets absorbed into the body and is converted in the liver to TMAO. And TMAO has been shown to cause narrowing of the blood vessels, leading to circulation problems, heart attacks, and strokes. We're also understanding that gut health can impact our mental health and vice versa. So in this picture, you can see at the letter A that stress causes the release of a hormone called cortisol. With prolonged inflammation, the exposure to cortisol can lead to a leaky gut at letter B. This can lead to the leaking of toxins such as LPS into the immune system side at the letter C, which then causes inflammation which travels around the body at letter D, including the brain at letter E, with subsequent brain inflammation and depression and anxiety at letter F. Now, I appreciate that there has been a lot of fear in the last couple of years around COVID, so I wanted to touch on the role of the gut microbiome in infections and provide you with some positive information. There has been some fascinating research on the role of the gut microbiome and the flu. So, when the flu enters the lungs and starts causing an infection, the beneficial microbes in the lungs communicate with the beneficial microbes in the gut, and it is the gut microbes that initiate the immune system response to the flu. So this shows you the importance of gut health and the significant role the gut microbiome can play in infectious diseases. And you may be asking the question, what about the gut microbiome and COVID? Well, here's the research so far. SARS-CoV-2, which is what causes the COVID-19 infection, can bind LPS that is circulating in the body and get into our cells. A lower diversity and levels of beneficial bacteria can increase the risk of more severe symptoms and the risk of long COVID symptoms. So with a healthy gut microbiome, we are more likely to protect ourselves from infections and long-term complications. And here are a couple of other considerations to take into account when looking at gut health. Antibiotics are used to treat people who may have a significant bacterial infection. However, antibiotics will also kill and reduce the number of good bacteria in the body. Therefore, it is important to use antibiotics only if truly required, which will be guided by your doctor. And did you know that 73% of global antimicrobial medicines, of which they are mainly antibiotics, are given to farm animals? Therefore, animal products will also damage the gut microbiome through their antibiotic content, as well as due to animal protein and fat. And also, pesticides used on plants and crops could also impact on gut health, and so it's ideal to eat as much organic as you can and even to grow some of your own foods. There is a very useful guide called the Dirty Dozen, which provides the 12 most pesticide-ridden foods which you should always aim to buy organic. So, is there anything we can do to rebuild and reverse gut health problems? Yes, by following the general 4R protocol. Remove the damaging factors. Replace in the gut what is missing, such as prebiotics and beneficial bacteria in the form of probiotics and fermented foods, which can help towards repairing the gut lining. And finally, how one can rebalance their lifestyle to maintain good health and minimize or prevent a decline. Well, we have seen and I'm sure appreciate the importance of fiber and polyphenol-rich whole plant foods. Additionally, there is research showing the benefit of exercise and also meditation and relaxation on the gut microbiome. But I hear you asking, what about my favorite Indian foods? Well, don't worry, because there will be some recipes following at the end. So, to conclude, I'm sure that we can all now appreciate the importance of our gut health and the microbes we house within. There are many factors that can promote the health and diversity of our gut, including fiber and nutrient-rich whole plant foods, exercise, meditation, being in nature and with animals. And it is this healthy and rich diversity that leads to unity in health across our being. Jai Sai Ram.
Thank you, Dr. Mahesh. It was a very informative presentation. We have got some questions now. How do we know if we have gut dysbiosis and what symptoms could alert to it?
Firstly, Jai Sai Ram to everyone. Thank you for having me here. It really is an honor and blessing to be with all of you. So essentially with respect to how we might know that we have a gut issue or a gut microbiome problem, essentially some of the things that we mentioned already in the presentation. So early on, when as a child, if you are not exposed to beneficial bacteria, if you're not exposed to the outdoors, for example, you may not be able to develop a tolerance in the immune system to things like pollen and other things outside in nature, to animals, to certain types of foods and these sorts of things. So this might manifest as allergies certain things, allergies to things that you would probably expect you shouldn't be harmful to you, such as fruits and vegetables, which we are starting to see more and more of these days. But also sensitivities. So I mentioned the word sensitivities. So it's not quite like allergies, or it's not as severe as allergies, where in an allergic response, you may get, itchy skin, a rash, breathing difficulties, very drastic symptoms like that. But in sensitivities, you may still get sort of a rash. It could be like an eczema type of rash. It could be that you get stomach pains, stomach cramps. You may get loose motions. You may feel sick. So these are some of the symptoms that would sort of indicate to you that maybe I have a gut microbiome or gut health problem in general. But then also later in life, when we were talking about the inflammation, that chronic irritation going on in the body, that can then lead to things like heart disease and diabetes and all sorts of other things, inflammatory bowel diseases, autoimmune conditions like rheumatism or thyroid problems or arthritic joints as well, for example. These can all be signs that there's something not quite right in the gut microbiome. And this is what the scientific research is now also showing us. A couple of other very common things that people may find that they are diagnosed with, or they may look on the internet and find, is the term IBS, or irritable bowel syndrome, where people experience very unpleasant symptoms such as bloating, cramping, feeling sick, diarrhea, constipation, these types of things. And what scientific research is actually showing now is that these symptoms and the term IBS is actually related very much to an imbalance in the bacteria in the gut as well. So IBS-like symptoms could also be an indication of gut health problems.
Thank you. Thank you for that. Are there any testing available to assess gut microbiome and or an inflamed leaky gut?
Sure. Okay. So yes, there are a number of tests that are available. These aren't all available on the NHS at the moment, however. So as we said, to look at the gut microbiome, we have bacteria everywhere, on ourselves, so on our skin and in our body, everywhere. So everywhere where we have what we call a mucus type of lining. So for example, in the mouth, down into the digestive tract, as we've seen, but also other places like our sinuses and our airways, and also in our urinary system. These all have mucus layers. So we have bacteria and microbes all there, and they all have their microbiomes. But as we saw with the gut microbiome, one of the ways that we can test this is by doing stool samples or poo samples. And so the gut microbiome is mainly what it's looking at is the large bowel, as we saw in one of the diagrams. That's where most of the bacteria in the gut are housed, essentially. So a poo sample will give us an idea of what is going on in your large bowel, essentially. It will give us an idea of the kinds of bacteria that are there. So we normally have bacteria there, as we've seen. We've seen the importance of the gut microbiome and the importance that bacteria play. So we normally have bacteria there. So what we're looking at with these tests is what is the balance of these microbes, these natural microbes that are meant to be there. Are they out of balance? Are they in balance? But what we're also looking at is, are there any harmful bacteria there that we need to do anything about? So that is one way of looking at the health of the gut microbiome. That will also, as we said, we spoke about things like IBS. That will also give us an indication as to whether there are any problems in the gut or any imbalance of bacteria that could be causing IBS symptoms. And if it's okay for me to just bring in another little topic here as well, is something that I've been hearing a lot from my patients recently, which is something I have a lot of experience in with my naturopathic background, is a condition called SIBO, SIBO, and that stands for small intestinal bacterial overgrowth. And that's something that happens in the small intestine. And I don't know if it's okay if I'm able to share my screen just to show that and illustrate that, really. So if I get my presentation up here, so I hope you can you see that at the moment?
Yes, we can.
You can see that. Okay,
yes.
Great. So if we have a look, so this picture here, if I turn this full screen, I hope you can see it in the full screen now. So this picture here shows you the gut again, and we spoke about the large intestine along here. I hope you can see my mouse, the large intestine here where the microbiome is, and where you can test with the stool test for the bacteria, any inflammation, and those sorts of things going on. This can give us an indication of IBS as well. But there is also another condition, as I just mentioned, SIBO, S-I-B-O, which stands for small intestinal bacterial overgrowth, which the small intestine is the blue part in this picture. And the small intestine actually comes before the large intestine and is connected to the stomach. It comes after the stomach. So essentially what the small intestine does is it's meant to help with continuing the digestion process of food that the stomach is doing, and it allows food and nutrients and all the important things to be absorbed into the body. But what can happen in certain cases, and maybe this is a bit too long to discuss in this presentation, but I'm more than happy to do it if you like. But in certain circumstances, what can happen is naturally the small intestine is meant to have far less bacteria compared to the large intestine, because it's a place where you're meant to digest and absorb food. So you don't want too many bacteria there to consume the nutrients, to digest and consume the nutrients for themselves. So relatively speaking, even though there are bacteria in the small intestine, it is a relatively cleaner or more sterile environment than the large intestine. But certain lifestyle circumstances can actually lead to an increase in the number of bacteria in the small intestine. So what can happen then is when you're eating and food is kind of going through the stomach and being digested, and it needs to continue digestion into the small intestine, the increased numbers of bacteria in the small intestine can actually start feeding on the food coming down. And what that does is that can ferment the food, and that can cause the formation of gas and different types of gases in the small intestine, which can cause very uncomfortable bloating. And in some people, depending on the types of gases that are formed, you can get constipation, you can get diarrhea. And not just that, it's not just related to gut symptoms, but just as we've seen with the large bowel and the gut microbiome, issues with overgrowth of bacteria in the small intestine can actually lead to problems elsewhere in the body. So we're seeing a lot of linking up happening now between the large intestine, the small intestine health, and other things showing up in the body, in the lungs or the skin or other places. So this thing, SIBO, is another thing that's very, very prevalent now as well. And although gut microbiome testing for the large intestine is not yet available on the NHS, increasingly I have seen testing for SIBO happening on the NHS now as well. And I think that's really important because when you have patients sort of coming to you with these chronic symptoms and you can't really give them a solution, you might be able to give them a medication to maybe help the symptoms, but they still have the symptoms and they're still suffering. It's important for us to start understanding that there are other conditions that we're starting to learn about. The scientific research is starting to grow, and that there are things that we can do, certainly from a natural and naturopathic perspective. I hope that provides a little bit more information.
Yes.
Okay,
Thank you.
That's all right. I will just stop sharing.
Thank you, Dr. Shah. So you mentioned testing for SIBO.
Yes.
So can the GPs test for that, or do patients have to be referred? Because obviously when patients come to us, we have done all the other investigations.
Yes.
So who considers testing for SIBO? And
Yeah, absolutely. So again, things like SIBO, conditions like SIBO are still very much becoming known in sort of the mainstream medical field. So just like we look for things like inflammatory bowel diseases or celiac disease, where you can't, where you have an allergic reaction to gluten in wheat. We're very familiar with those conditions, but things even like IBS, for example, we're not fully familiar in the mainstream medical field in how to deal with that. So SIBO is one of those at the moment as well, where we're not fully aware of what it is, but the research and the awareness is starting to grow, and we are starting to see more and more gastroenterologists or gut specialists in the hospitals recognizing SIBO and testing for SIBO. So I've seen that happen in my local area as well. I think on the NHS, it very much depends on where you are, which gastroenterology department is aware of it, recognizes it, and is starting to test for it. And I think it also very much depends on the GP's awareness of the condition as well. But it's certainly something that is available to be tested privately. So there are private labs that do test for SIBO readily, as they do for things like gut microbiome, stool testing, etc.
Thank you. Thank you. So if the test comes positive, so there are sort of a tablet or dietary advice the gastroenterologist can give?
Sure. So again, so with everything, with the gut microbiome, with SIBO, maybe we can start with the gut microbiome. So when you looking at the large intestine and you get that stool sample, that poo sample report back, what it shows you a number of different things. It shows you firstly what your digestive process is like in the gut, and that's very, very important, because if your digestion is not working properly, then that could lead to undigested food particles and other things sort of getting through into the system. So for example, one example would be, and this is not necessarily tested on the gut microbiome, but it's very important to know, especially when looking at other factors that can cause an imbalance in the microbes, can cause something like SIBO, where you get an overgrowth of bacteria. So for example, if your digestive system is not working properly and you actually have too low stomach acid levels, I know we're very aware of high acid levels, but if you have too low acid levels, we've got to think, what is stomach acid doing? Well, stomach acid is there, A, to help with digestion, but it's also there to help protect us from harmful things, harmful microbes, because it's a very acidic environment. It's a very hostile environment, the stomach, in that sense. So it kills a lot of the things, as we said, things coming from the outside world, they're not clean or sterile. So that's why things going into our mouth and into our gut, they need to be surveyed by the gut immune system. That's why we need such a robust immune system in the gut. That's why it needs to be trained properly, so that it doesn't react to everything, but it reacts to the right things. But if you don't have the right stomach acid level, effectively your first barrier to harmful things coming from the outside world is gone. So what is happening now is that potentially harmful bacteria and harmful toxins can bypass the stomach and start getting into the small intestine and the large intestine as well. So from that perspective, so the digestive processes are very, very important, and we check for digestive processes on these tests. The gut microbiome tests also look at, obviously the beneficial bacteria that we looked at. They tell you about whether there's any harmful bacteria, parasites, anything like this. And it also tells you about inflammation. Is there inflammation going on in the gut? So that's what you find in sort of that test. And the SIBO test is a breath test. So you would take a number of breath samples, and then that essentially tells you, with the gases that are formed, whether there is an overgrowth of bacteria or not. And then that can be treated in different ways. So you can look at it from as we briefly mentioned, the 4R protocol. So the 4R protocol, looking at how we can cleanse our gut and rebuild our gut to good health again. So, for example, we said to remove. So remove the things that are causing harm in the first place. So we saw a lot of the things there. So, for example, processed foods, animal products, stress, lack of physical activity, these sorts of things can cause ill health in the gut. So you want to essentially remove those sorts of things. You want to replace them with the good things. So things like probiotics, which are bacteria, beneficial bacteria, prebiotics, which we saw are the fibers coming into the in through the diet, which can help the beneficial bacteria to grow and to produce the postbiotics, which help with gut health and overall health as well. And that helps to also repair the prebiotics, the probiotics, as well as nutrients, helps to repair the third R, repair the gut lining. And then it's the fourth R, rebalance. So once we've done this whole repairing process, and what can we do to actually maintain this? And to maintain that is where we're looking at our diet and our lifestyle and those factors to keep the gut healthy. And for SIBO, it's very much a similar thing as well, is looking at the factors that are reducing the digestive system processes like stomach acid, allowing bacteria to overgrow, and what we can do to improve that. From a medical perspective, as we said, SIBO is becoming more recognized. From a medical perspective, a gastroenterologist could give you specific antibiotics to get rid of the bacteria that are starting to overgrow in the small intestine. But again, if we think about it, this is very much a symptom-based approach. So someone has got an overgrowth of bacteria. So let's give them antibiotics to bring down the number of those bacteria and help improve the symptoms. But what we're lacking there is we're lacking the idea and the understanding of what is actually causing that imbalance in the first place. What is actually causing those bacteria to overgrow in the small intestine in the first place? And those are the factors of not having the enough stomach acid, which can allow bacteria to harbor in the small intestine. Stress as well, which can slow the gut immune or the gut down and can stop the process of the gut moving because there is this constant brushing motion through the gut that helps brush it from up here all the way down. But stress stops that. So we have to start addressing these things in order to help prevent the overgrowth again. And I have seen that happen with patients who have been treated for SIBO with antibiotics, but then they come back with the same symptoms because the root causes, such as stress and a low digestive system, they cause the regrowth of the bacteria. So it's almost like a cycle. So you have to get down to that root cause. And you do find that that's what patients in general, for all of their symptoms, whatever it may be, we do find that that's what patients are asking more and more about, is that I don't just want the painkiller for the pain. I want to know what is causing the pain. I want to get to the root cause of the pain. And I think that's the next area of healthcare and medicine that we are starting to break through, but we really need to make that breakthrough for.
Thank you.
No
Another
problem.
practical questions. Are there many prebiotics and probiotics on the market? What do we need to look for when we are buying them?
Sure, absolutely. So there are many, and I'm sure we're all aware of them. And so yes, there are many probiotics, and there have been many probiotics on the shelf for a long time. Prebiotics is something that we're becoming more aware of. So just to clarify that again, so prebiotics are basically fiber. And fiber feeds the good bacteria, and the good bacteria use the prebiotics, the fiber, to make postbiotics. So probiotics and postbiotics. And those postbiotics are important for gut health and overall health in the body. So prebiotics is something that is becoming people are starting to understand more about now. Now, firstly, before we get into supplements and these things, the important thing is that we can actually get prebiotics and probiotics from our diet. That's the first thing. So we mentioned prebiotics already. Prebiotics comes from fiber-rich foods. So we spoke about whole plant foods such as fruits, vegetables, whole grains, beans, lentils, nuts and seeds, mushrooms, herbs, spices. All of these things provide lots and lots of fiber. And there are certain types of prebiotics. There's one called FOS, F-O-S, or fructo oligosaccharides, and also another one called inulin, which we are finding out in the research are very, very beneficial to gut health and overall health. And these are found naturally, of course, as well, and you can find them in bananas, onions, garlic, leek, artichoke, asparagus. So, all of the plant foods, they have these wonderful prebiotics. Probiotics as well. We can find these in foods as well. So we think about fermented foods, for example. So fermented foods, so you have things like sauerkraut, kimchi, kombucha. You can get things like water and coconut-based kefir as well. So these are probiotics. So these ferment and these produce beneficial bacteria, which then they can then sort of start to help to populate the gut with good bacteria. But it's always important to make sure that we have those prebiotics there. There's no point in putting the probiotics in if you're not giving them the fuel that they need to survive and thrive in the gut, which is the prebiotics. So from a supplement perspective, and I must stress that it is a supplement, so it's not there to replace your diet or your lifestyle, but it is a supplement. And there are important cases where prebiotic supplements, probiotic supplements are necessary. So as part of rebuilding one's gut to a sort of a good place in good health, prebiotics and probiotics may well be necessary. So as I said, FOS, fructo oligosaccharides, and inulin are important types of prebiotics to look for. Probiotics, we're finding in the scientific research that there are specific types of bacteria that are particularly good for specific symptoms. But generally speaking, we've known for a long time that classes of bacteria such as lactobacillus, bifidobacteria are generally very good for gut health. And there are other more specific ones as well, which I won't necessarily get into, and they're not necessarily even available as supplements yet. And then there is also another beneficial microbe called Saccharomyces. Now, this isn't a bacteria, but it's actually a fungus. And it sort of naturally lives in our gut as well. So Saccharomyces has been shown to have many beneficial effects as well. So from a probiotic perspective, I would suggest that looking for ones with bifidobacteria, lactobacillus, maybe Saccharomyces is important. But I would always, get someone's sort of advice on this, whether it be your doctor, whether it be a naturopathic practitioner like myself as well. It'd be important to get advice because what you don't want to do is you don't want to keep on having the same probiotic all the time, because all you're doing then is you're putting the same few types of bacteria into your gut. Remember, we want a diverse microbiome because we know that diversity helps in keeping the body healthy and in unity, as Swami's teaching says. So it's always important, if you are taking probiotics, it's always important that you cycle them. So you look at broad spectrum, so ones that have lots, but then you cycle through them as well, so you're getting different ones. But as I stressed, the most important thing first is looking at your diet and your lifestyle first, and then supplementing as necessary. Just a quick point here as well. With SIBO, we mentioned that SIBO, there's an increase in the number of bacteria in the small intestine, which isn't a natural thing to happen. So theoretically, what could happen is if you are taking probiotics or even prebiotics, then what could happen is the probiotics could start to grow in the small intestine, and the prebiotics could feed the overgrown bacteria in the small intestine, and could, I'm not saying definitely would, but could potentially worsen the symptoms of SIBO, such as the constipation or the diarrhea or the cramping or the bloating and those sorts of things. So that's just something to be aware of. So if you don't get better or you don't feel better, or maybe you feel worse by taking prebiotics or probiotics, it might be that you just have a very bad imbalance in your gut, or it could also be that you have an overgrowth, something like SIBO as well. But always important to speak to your doctor, or as I said, speak to someone who is naturopathically trained as well.
Thank you, Mahesh. I've got another question. Does filtered cow's milk also run similar gut disease risk due to exposure to animal hormones and fertilizer in the food chain?
Yeah, so absolutely. So as we touched on earlier, there's a lot of use of antibiotics, pesticides, herbicides in the food, in our food these days. So we know through the scientific research that this is having an effect on our gut microbiome and on our general health. And we're also aware that a lot of animals, a lot of livestock are also given hormones, injected with hormones as well. Indeed, this is going to have an impact on our hormone balance as well. And also the other fact is that milk as well, let's say dairy, for example. So if we think about dairy and we take a step back and we think, what is milk exactly? And we think that every mammal on this planet feeds its baby breast milk, right? Even us, even humans do that. But what seems to have happened is, and where humans differ, is that where the other mammals tend to wean their child, their baby, off milk, and then they start eating solids. Sure, we do that as well. We do wean our children off breast milk and start feeding them solid foods. But what we're doing is we're then feeding them the milk from another mammal. But if we look at what nature does, we can see that nature obviously stops the baby from having milk once the baby's able to eat solids. But it's only human beings that have continued to follow the trend of drinking milk, and that of another mammal. And that can cause issues. So we've already mentioned about, obviously from an industrial perspective, the use of antibiotics, herbicides, pesticides, hormones. But also, if you think about, for example, the most common type of milk that that humans drink is cow's milk. So if we take the mammal of the cow and the mammal of the human, we can already see a number of differences. So we can see that the baby cow, the calf, grows a lot quicker and a lot faster than a human child, and the full size of the cow is reached a lot quicker than the full size of a human being. So the composition of cow's milk is very different to human breast milk. So, for example, there's a lot more what we would call a lot more different types of fats. So saturated fat, for example, is a lot higher in animal or cow's milk. And we know that saturated fat can lead to things like heart disease, diabetes as well. And we've seen the link with these things in the gut microbiome as well. And it also contains a lot more protein as well. And that's because, of course, the calf is growing a lot quicker, and so needs the extra protein to be able to generate and grow the cells quicker, whereas we don't. So what tends to happen is with the animal proteins, when we consume that as humans, and especially when we consume that as adults, when we have stopped the growth process, what the proteins can do is that they can actually turn off the growth signals of the cells in the body. And that can be quite dangerous, as we are finding out in the scientific research, because it can actually turn off the processes in the body that would alert our body to say, hey, this is a cancerous cell. This cancer cell needs to kill itself. And that's what's happening in our body all the time. We have these switches in every cell, and if it recognizes that it's becoming cancerous, it flicks that switch and it kills itself, because we don't want cancer in the body. It knows. But what happens with excess hormones, growth hormones, and excess animal protein is that this switch is disabled. So that the cells of the body, even cancerous cells and damaged cells, can start replicating and can start the process of the growth of cancer, tumors, etc., etc. And this is something that we're seeing in the scientific research as well. So I hope that kind of answered the question and maybe elaborates a little bit more information as well.
Definitely. Thank you. That's very, very informative.
No problem.
This is a very broad question, Dr. Shah.
Sure.
If someone suffers from alternating constipation and diarrhea, what can they do to resolve the issue?
Okay. So I think the first thing we need to consider is what firstly, is there a trigger? Is there a trigger for the constipation? Is there a trigger for the diarrhea? So is there a trigger for the constipation? For example, are there particularly stressful days where you forget to drink or anything like that, and you're becoming dehydrated, you're not as physically active? Some people, when they get stressed, they have the opposite. They tend to have, a lot of people tend to have loose emotions, for example. So looking at your day-to-day activities, firstly, is important. What is your day-to-day routine? Stress levels, these sorts of things are very, very important. Looking at your food intake is very important as well. So making sure that you're getting the fiber-rich foods in as well to help with constipation. Looking for food triggers. So are there certain food triggers? So you could have, in a lot of people, and you see this in a lot of children, for example, dairy can actually cause a lot of constipation as well. So is that a trigger for constipation? But a lot of people can also get loose emotions because they may be lactose intolerant, which you find in dairy. So you've got to look and see what is it? Is there a specific trigger in your diet that is, or your lifestyle, that is causing constipation, that is causing diarrhea? But then you've also then got to consider, is there an imbalance in the gut microbiome? Is there an overgrowth of bacteria in your small intestine? As we said, with something like SIBO, you can get diarrhea, you can get constipation. Do you have something like irritable bowel syndrome in the large bowel? When we know, that some people with irritable bowel syndrome can have diarrhea, some can have constipation, some can have a mixed picture as well. So there's a number of different things to consider. So I think what I would suggest is maybe initially is making sure that you don't have any danger signs, which you should definitely see your doctor about. So what we would call red flag signs. So seeing, do you have any blood in the motions, whether it's with constipation, whether it's with loose emotions? Have you got any appetite loss? Are you losing weight? Have you had a recent change to your bowel habits, which isn't sort of normal for you? So any of these, especially as you're getting older, over the age of 50, 60, if you're noticing any of these red flag signs, you should definitely see your doctor straight away, who can initiate some urgent investigations. But otherwise, looking at keeping things like a food diary, keeping things like, even a stress diary, and trying to sort of see how that relates to your bowel motions. These things are very, very important. And then consulting your doctor about that, or consulting a holistic therapist or a naturopathic therapist like myself, to see what can we do with your lifestyle and diet to help solve this issue. So it's a very broad answer. But I think, if, like I have with my clients in my private practice, or with my patients in my GP practice, when you have the person in front of you and you can get the specific history and information, it's then easier to then tailor the information. So, I'm more than happy if there are people in the audience who have any questions based on this. I'm more than happy for them to contact me, and I can leave my contact details with the team at the end. That's absolutely fine.
Thank you, Dr. Shah. Thank you for clarifying that, because as you say that these constipation and diarrhea is sort of, we have to take everybody symptoms, individually, their age, their sort of lifestyle, and other symptoms. So it's like a holistic assessment, isn't it? I mean, we can't just, we can't, not a one word answer. We have to take it according to the the person sitting in front of you.
That's absolutely true, absolutely right. And I think that's what's happened is, I think for a long time, medicine has been very generalized. So we take a general approach to everybody. But what even the scientific research and the medical field is starting to realize is that it's very important to have an individualized health approach, because everybody has their differences. Even in the gut microbiome, the diverse gut microbiome, we all have our slight differences in the gut microbiome. That's very important to understand as well. So yes, the individualized, personalized approach is very, very important.
Thank you. I've got some more questions, if that's okay.
Sure.
Based on dietary practices, are there any populations in the world where rates of chronic diseases are less?
Okay, so I'm just going to very quickly screen share again, if that's okay, in the last few minutes that we have. So I'm just going to take you back to my presentation. I hope you can see this slide called the blue zones.
Yes, you can.
Yeah. So the blue zones are areas in the world, populations in the world that have been studied for their great health and longevity. And as you can see from the map, they're across the planet, from Loma Linda, California, Costa Rica, through to Europe, in Italy and Greece, and all the way across to Asia, in Japan. And what we find is that these people sort of live long, happy, healthy lives. And what we find, as you can see here, is that they move a lot. They're very active. They have tribe, so they have this sense of community and togetherness, which is so important as well. They have the right outlook and perspective of life, which we are all blessed to have the wonderful teachings of Swami to guide us on our perspective and understanding of life, and how he's our guide and with us all the time. And also they eat wisely. So they eat sort of very much, largely sort of a plant-based diets, whole plant foods, as we've seen. And if you can see this next slide, then this next slide refers to Loma Linda, California, which is one of the blue zones. And they have a very kind of varied diet in that place. There are non-vegetarians, there are semi-vegetarians who eat less meat than the non-vegetarians, there are pescatarians who consume fish in terms of animal products. Then there are the vegetarians, and then there are the plant-based, the vegans as well. So there was a scientific study, and these scientific population studies are still ongoing, and they wanted to look at the rate of diseases. So the next slide, and this is very busy, but I'll very kind of simply explain it, is you can see the non-vegetarians down to the plant-based vegan group, and across the top you can see BMI, which is a very rough measure of kind of how healthy your weight is compared to your height. Then you can see diabetes and hypertension or high blood pressure. And what you can see is in the non-vegetarian group, they had a BMI of around 28. Now, a BMI of sort of 18 and a half, 19 to 25 is considered healthy, 25 to 30 is considered overweight, and over 30 is obese. So on average, what you can see is the BMI reduced as you go down, and it was really only the plant-based or the vegan group that had, on average, the healthiest, a healthy BMI. And again, you can see the rate of diabetes go down. You can see the number 1 here for the non-vegetarians, and it's reducing 0.72, 0.49, 0.39, 0.22. And again, with hypertension, the same. You can see the numbers, the percentage, or the decimals going down, 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 down. So you can see through this population model how, based on the kinds of foods you're consuming, the more plant-based you are, the less likely you are to have these diseases. And I hope we have kind of understood and appreciated from this presentation the importance the gut microbiome plays in this. If it gets the fibers, if it has the right bacteria, it is healthy, and it can keep the rest of the body healthy, preventing and protecting you from chronic diseases like heart disease, diabetes, cancers, etc., etc., and keeping you in good health and happiness, and maintaining and thriving in that unity in diversity, as Swami so beautifully puts it as.
Thank you. That's excellent, Dr. Shah. Now, last question, but very, very important question. Have you got any recipes to share?
I do actually,
Yes. Okay, that's
and
great.
I know where again we're a little bit short on time, but and again I'm happy to share more information on this, but just again a few very quick slides on this. Now, we did mention that obviously, you know, the Indian foods, we love our Indian foods, but we do understand that they can have a lot of fat and these sorts of things. So I hope you can see this this slide, a very
Yes, we
traditional,
can.
recipe or dish, kadhi, which I'm sure a lot of people know of. So traditionally, it may use dairy products, but there are ways that you can actually make it plant-based. So I've sourced these pictures and these recipes from another organization. So thank you to them for sharing these wonderful recipes. But you can see here is a kind of like an ingredients list, which I'm sure many people recognize as part of the dish, the kadhi dish. But you can actually, at the top, you can see you can actually replace dairy with other types of plant-based yogurts. So you can get soy yogurt, you can get other ones as well. And no need to go through the method because I'm sure everybody knows how to cook it. And then, of course, there's paneer as well, and how you can actually make paneer a little bit more healthy. So, of course, we know paneer is cheese-based, but we know cheese has a lot of saturated fat, and we've seen how that can affect the gut microbiome, and we know saturated fat increases the risk of heart disease. So you can replace it with tofu, for example. So tofu is a great alternative. It can be shaped and it can have the same texture as paneer, but it also has many health benefits. It's high in plant-based protein. It's also a good source of plant-based and healthy fats as well. And also soy, which is what tofu comes from, is also very beneficial for hormone health. Contrary to what you may hear in the media about soy being related to breast cancer, the opposite is very true. And it's important to make sure that it's organic as well. But maybe that's soy is a topic for another day. And very lastly, also, we must know about this dessert or sweet dish, sira or shira. Now that can have ghee, it can have milk in it, but you can very easily, as you can see from the ingredients, you can very easily replace it with plant-based and healthier versions such as almond milk. And you can find the sort of full ingredients and methods for these. I'm more than happy to share the details of the organization and website that has these recipes on there if anybody's interested. So again, I'll stop sharing. Hope that was okay. I think you're muted.
Sorry, that was really interesting. Thank you, Dr. Shah. I'm definitely going to try those during Easter break.
Sure.
So I really would like to have please share the link with us, and I'm definitely going to try that.
Yes.
Thank you. So
no
that's
problem.
really very informative webinar. I would like to thank Dr. Mahesh Shah for his excellent presentation. And a very big thank you to Seshan and Tushar for the IT support, and Dr. Meera for the introduction. Our thanks to Dr. Upadhyaya for guiding us, advising and supporting us, and to Gayatri for coordinating these webinars and for all the background work she does so tirelessly. And thank you all of you for joining in this session. And we really hope that you found it informative and practical. And I'm sure you're going to try all these recipes Dr. Shah mentioned, and we can share the link with you all. We look forward to welcoming you again to our next webinar, which will be on the 3rd of May. We haven't got a topic yet, but we will inform you through the flyers. So please join us on the 3rd of May, which will be a Tuesday. Thank you. Sai Ram.